Have you ever wondered why two people can check the same patient's blood pressure and the reading to be different? Here's the truth. About 60% of inaccurate blood pressure readings are as a result of little technique errors that you can avoid. Here is what I mean. Small errors like using the wrong cuff size or wrong positioning of the cuff on the arm could either make the reading too high or too low. And this could be very dangerous for a patient, especially if you are using that blood pressure reading to make clinical decisions. But relax, after watching this video, you will no longer take inaccurate blood pressure readings again. So let's dive into it. Before you check a patient's blood pressure, you have to make sure that this patient has been resting for at least 5 to 30 minutes. And then this patient must be kept in a comfortable position, preferably a sitting position with his arm supported, maybe on a table. And then there are some requirements you need. You need your stethoscope and your sphygmomanometer. So watch me as I check my patient's blood pressure. The first thing you want to do is to prepare your patient and then find the radial artery as I'm finding, and then also make sure you find the brachial artery. It's going to be pulsating. As you can see, it's located towards the antecubital space, just the place I'm placing my thumb. That is where you find the brachial artery. And after that, you want to bring your sphygmomanometer. You bring the cuff and wrap it on the patient's arm. Remember to use the accurate cuff size, because too large or too small cuff could give you a wrong result. Now you wrap the cuff firmly on the patient's arm, making sure that it is not too loose or too tight, so that it does not alter your patient's blood pressure reading. And make sure that your patient is comfortable throughout the procedure. Now you can take the pump, and then it has a little knob there. Then you turn it all the way to the right, and to make sure it is locked so that the air won't leak as you pump it. Now try to feel the radial pulse as you pump the cuff until it disappears. When it disappears, it now pump about 10 to 15 mercury more on the sphygmomanometer. Now place your stethoscope over the brachial artery and begin to listen as you deflate the cuff. You have to deflate the cuff gradually so that you can get the actual reading. As you listen, take note of the point where the pulse comes back. That is the systolic blood pressure. And the point where the sound disappears is the diastolic blood pressure. And when the sound disappears, you may now want to release all the air that is inside the sphygmomanometer. And after this, you remove the cuff from the patient's hand, thank the patient, and then you document the reading you've gotten. Remember, in nursing, if it was not documented, it means that it did not happen. At this point, you have learned the accurate ways to check blood pressure. Do well to subscribe to this channel so that you will not miss out on any of our uploads. I promise you, I'll be giving you back-to-back updates on nursing tutorials. So do well to subscribe so that you don't miss out on the next one.